Well, I'm a general dentist, and I probably in the last 10, 12 years have spent several $100,000 just studying the area of aesthetics. That's one thing that I've been very, very, very interested in. Another one is sleep as it relates to what can happen dentally. And I'm a snorer and have some sleep apnea. And I've taken some courses in that and now treat patients for sleep apnea with an oral appliance. And what we know about sleep apnea basically is the stopping of breathing for 10 seconds or longer. And basically what happens is people and they don't get oxygen, and there's a whole bunch of different side effects that happen as a result of that. The standard of care for treating sleep apnea is the CPAP machine, or BiPAP, or AutoPAP. And just in the last 2 years, the American Academy of Dental Sleep Medicine, the American Academy of Sleep Medicine, both have come forward and said that for mild and moderate sleep apnea, an oral appliance can be used as a first line of defense. And so I've been doing it. I've got about, right now, 220 patients that I've put oral appliances in to treat for sleep apnea. I would say that 65 to 70% are life-changing events. It's a real simple thing. Basically all it does is holds your mandible or lower jaw forward. When it holds your lower jaw forward, the tongue stays away from the back of your throat or the pharyngeal wall, and the airway stays open, and you sleep better. And people that have sleep apnea don't dream. They have to get up a couple times at night to go to the bathroom because their body never gets into deep stage sleep. And all of a sudden, with an oral appliance, this all changes. So that's been very, very, very interesting. And I've worn an oral appliance myself for the last 8 years, and I think I could count on one hand the number of nights that I have not worn it. And very comfortable, very easy. It's just like a football mouth guard in some respects. So very simple, and there's no tubes or cords or anything, so you can travel with it, take it fishing, anything you want. And the other interesting thing about that was when I got into that field, I thought, boy, this will be, for the guys in deer camp or fishing camp, And in reality, probably 55–60% of the patients that I have treated are women. And so women have the snoring and sleep apnea problems just as much as men do. And the interesting part about that is that when you have sleep apnea, you don't get into deep stage sleep. When you don't get into deep stage sleep, the hormone that regulates fat metabolism doesn't activate, and you store fat instead of burning it. So you gain weight. The more weight you gain, the more sleep apnea you have. The more sleep apnea you have, the more weight you gain. So it's kind of a downward spiral. So treating sleep apnea can change people's health a great deal, and it's been very interesting for me.